Welcome to the latest PediaTrust question and answer session, Ask the Pediatrician webinar, COVID vaccine for 5 to 11-year-olds. My name is Ruben Rucoba. I'm the Director of Medical Services for PediaTrust and your host for tonight's session. Our panel tonight includes Dr. Julie Goynshor, pediatrician at Woodfield Pediatrics in Schaumburg, Dr. Michael Siegel, pediatrician at Highland Park Pediatric Associates in Highland Park, and Dr. Soma Mukherjee, pediatrician at Pediatric Partners with offices in Vernon Hills and Highland Park. Our session tonight will be an hour long and will be recorded. We'll be sending an email to everyone over the next few days who registered for this event with a link to that recording. We've had questions coming in for the past few weeks, and we'll get to as many of those as we can. But those of you watching tonight can also submit questions live, either through the chat function of the Zoom call or through Facebook Live, and we'll try to get to some of those as well. I also want to remind everybody that for the last several days, we've been having mass vaccination clinics at many of our PediaTrust sites where we've been giving the COVID vaccine to 5 to 11-year-olds, and it's available at all of our offices for well child visits during regularly scheduled visits. If you need to know more about how to schedule an appointment, visit our website, www.pediatrust.com/COVID. Pediatrust.com/COVID. All right, let's start off with a very basic question, and this one goes to Dr. Goynshor. What evidence is there that children 5 to 11 years old even need this shot? Children rarely get seriously ill with COVID, so why should they get it? Dr. Goynshor, what do you say?
That is the million-dollar question, and that's what we all want to know. I think of it as three ways, honestly. I think about it as our own children. So let's start with the first part, our own children or our child. This is not the same for most children as it is for older adults. And I think at this point, we are well aware of the differences. However, just because this is not as nearly as deadly to children as it has been to older adults, it does not mean that this is a nothing for our kids. Since the beginning of the pandemic in the US alone, in the 5 to 11-year-old age range, there have been nearly 8,500 hospitalizations, with a third of those, am I correct? A third of those requiring ICU level care. There have been over 100 children in the 5 to 11-year-old age range who have died from COVID. That makes that much more deadly than most of the things that we are currently vaccinating our children for. So it's still something. And we also don't know the effects we are starting to learn more about the long-term effects of long COVID. Children can get that as well, making them susceptible to many different illnesses. And we've talked about this for adults, but it is not something that I want to scare everybody, but it is something that is real and potentially deadly to our children. Second thing I think of what does it mean for our kids in terms of their everyday life? Our children, at least I feel that our children have sacrificed a lot during this pandemic. They have given up school, they've given up activities, they've given up social interactions. We've asked a lot more than we have ever asked of ourselves for our children this past 20 months. And our kids need to be children. They need the social interactions. We have seen a huge increase in depression and anxiety and obesity during this with our children, which we hope they will, and we are optimistic about the long-term sequelae of that. But our kids need to get back to activities. And one of the things that this will allow our children to do that. So those are the two things I think of when I think of our own kids. And then when I think about the third reason to do this is the altruistic reason, because our kids can play a role in ending and slowing down this pandemic and really ending this and protecting. They can protect their grandparents. They can protect their infant and their cousins that are infants. They have a role to play in protecting those. I had a mom yesterday who called it a circle of immunity. And that's kind of what we need to do. We need to be able to kind of put that hug around as many people as we can. And it is our responsibility to make our children who are going to school and who should be going to birthday parties and hopefully soon doing things, that they will be able to decrease the spread of COVID to those who are most at risk. So, because even our grandparents or their grandparents, even fully vaccinated, they are still at a higher risk for hospitalization and death from COVID then it is still a risk for them, and we can do something to help protect them. So I can think about it selfishly by protecting them, our own children, and then also on a grander scale, protecting those who can't be fully protected for a variety of reasons. That's my thoughts.
Thank you, Dr. Goynshor. Dr. Siegel, one parent asked, what side effects can we expect? And are some side effects different from adults, specifically the heart issues that we've seen in boys?
Most of the side effects from the 5 to 11-year-olds have been the same side effects of what we've seen in adults, only milder. So the most common ones are things like pain where the site of the injection. Occasionally we'll see fevers, some headaches, some body aches, some diarrhea, a little bit of fatigue. Very rarely you may see some chills. It's more common to get side effects with the second dose than with the first dose. The side effect that's been most publicized is myocarditis. And what myocarditis is inflammation of the heart muscle itself. Pericarditis is inflammation of the air of the surrounding sac. That tends to happen more in adults, but in children it seems to be more myocarditis. It's a very rare side effect. It happens generally within the week of the vaccine. It's statistically a little more common with the second dose than the first dose, and it is more frequent in males than in females. Most of these patients who have had myocarditis do require hospitalizations, but most of them have been home in 2-3 days. So about as long as it was to give birth to the child. As far as medicines that are used to treat them, most of them are not on any medicine stronger than ibuprofen. So just a general anti-inflammatory agent. There have been no deaths associated with this vaccine. Myocarditis is generally caused by viruses, and the COVID virus is one that does cause myocarditis, and it does cause a very severe form of myocarditis. Other causes are autoimmune diseases and heavy metals, and certain medicines do cause myocarditis, the most classic ones being chemotherapeutic agents. Most of the cases of MISC, the multisystem inflammatory syndrome of childhood, at least 80% of all of those children who get that diagnosis have had myocarditis, and the myocarditis is much more severe than what we've seen associated with the vaccine. So those are the side effects that we've heard about. I don't anticipate a whole lot more at this time.
Thank you. Dr. Mukherjee, is the dose based on age or weight or something else?
A good question. The dose is actually based entirely on age at the time that you're getting the vaccine. The only exception is for the children that are going to be turning 12 during the interval between the 2 doses. Now, we haven't brought this up yet, but this vaccine is dosed for children as it is for the 12 and over age group in terms of being 2 doses. So the interval is 3 weeks. That's the recommended interval in between the doses. So if you have a child who's turning 12 in that 3-week period, then you actually have one of 3 options. You can either choose the 11-year-old, the 5 to 11-year-old dose for both doses, or you could choose the 11-year-old dose for when your child is 11 for the first dose and the larger 12-year-old dose for the second dose, or you can choose the 12-year-old dose for both doses. So I think it would be a good idea if your child falls into this situation that you discuss it with your medical provider to decide which option is going to be the best for you or for your child.
Thank you. And as a follow-up question, what is the dose for the 5 to 11-year-olds as compared to the 12 and up?
Sure. So the dose is a 10 microgram dose, which is a third of the 12 and up dose, which is the 30 microgram dose, and it's also delivered in a smaller volume. So it's delivered in a 0.2 ml, very tiny volume. The older kids and adults get a 0.3 milliliter dose, so it's slightly larger.
Okay, Dr. Goynshor, we've had a couple of questions, including one that came in on the chat tonight that are all related to the size of the studies that have been done on 5 to 11-year-olds. One parent asked specifically about your practice. Sample size of kids in 5 to 11 years is a worry. How will Woodfield Pediatrics help monitor and respond to any adverse impact?
I think it's a really good question. So the studies we're looking at, they looked at several thousand children, but it wasn't tens of thousands or millions of kids. I don't know if it's cool. I think what's really amazing about where we live is that we already have a system in place for all that for following vaccine. We have a system called the Vaccine Adverse Events Reporting System. And we have had this since before any of our kids were at least any of my children ever had shots. It is a post study trials that we see report anything that side effects, whether it be mild side effects or substantial or unrelated. So sometimes it can be an overdose or of a totally unrelated thing that is automatically sent to a database and continued to study. So from a global system, all of us are watching this. We want to know side effects. We want to know how you're feeling. We have been tracking tens of millions of adults in the US who have been vaccinated, are all part of that, and with the thing called the VSafe or Vaccine Safe campaign, which is not a campaign. It's really tracking the side effects that you're having or may or be having from the vaccine. On a personal note, I think I'm going to speak for Soma and for Mick and tell us, we want to know what your child's feeling. We want to know how if something's wrong, please call us. The same thing is, if you see something, say something. It is, if you are concerned, we would rather have you call us or call me or send us a MyChart message or reach out to your doctor and let them know what's going on. And we can discuss what's real, what's from, and we can sort it out together. Don't ignore things. And I think that's the number one way. Remember, this is a team. You guys are, and everybody is part of this together, helping our kids.
Thank you. Dr. Siegel, here's a very common question we got multiple times. Quote, where did the negative impact the vaccines will have on fertility concerns come from, and are they legitimate, unquote?
So there's been a lot of reports of this. There's a lot of misinformation about fertility in the literature. The information we have thus far from the COVID vaccines is thousands of people have gotten pregnant after they've been fully vaccinated. There is no data to suggest that vaccines cause infertility, but it is a common piece of information that is sent out. There's a lot of theories on how this may happen, but there's no data to suggest that it actually occurs. Historically, this argument about vaccines causing sterility, it has gone back for a number of years. Back in the early 2000s, the World Health Organization was hoping to declare the world safe from polio. There was a rumor that was started in areas around in Nigeria specifically that stated that it was a Western plot to sterilize their population. Since that time, we still have to now vaccinate against polio because not enough of the population there actually accepted the vaccine. So it's an argument that's been used repeatedly, but there's been no data with polio vaccine causing this or any other vaccine causing fertility, and it's come up with each new vaccine. It's usually one of the early arguments that's sent out and then propagated. But that's what happens historically, and we, of course, still need to use polio vaccine. It was supposed to go the way of smallpox vaccine, which none of us, I believe, on the call have had.
Thank you. One parent asked a very good question. Quote, it looks like the Pfizer vaccine for kids 5 to 11 will be approved with a recommended interval, as Dr. Mukherjee mentioned, of 3 weeks between dosages. Do you advise 3 weeks, or might a longer interval be better, as some research on the vaccine for adults has suggested? Dr. Mukherjee, what do you say? You're on mute.
Sorry about that. I say we should stick with the recommended guideline. So the recommended guideline is 3 weeks. Definitely we want the second dose between 3 and 6 weeks. The one thing though is if for some reason you can't have your child can't receive that second dose within 6 weeks, there is no guideline to actually repeat the series. So you would just get that second dose, at any time, but the 3 to 6 week guideline is preferred.
All right. Dr. Goynshor, one parent asked, why should I vaccinate my child if she's already had COVID? And similarly, another parent asked, if you had COVID, do the antibodies work better? I assume that parent means the antibodies from the infection as opposed to from the vaccine. How do you answer those questions?
So if let me talk to the parent about the child who's already had COVID, because if my child, congratulations, you're going to have child is going to have the best protection. What we have seen worldwide data is the combination of already having a COVID vaccine plus the vaccination gives a really strong, robust, neutralizing antibodies. That's kind of the fancy word for saying it's going to protect your child the best. Which is, I think, ultimately what all of us want for our kids. The natural immunity is something that we've talked a lot about in the first 12 months of COVID. And there is some protection for some time. We can talk about 90 days kind of as the short term that we know that you probably have antibodies. The problem we have is that those antibodies are more specific to the certain strain that they had. And we are seeing a lot more people who've already had COVID, especially in adults, getting hospitalized with another case of COVID, simply because antibodies are more specific and they may wean and wane over time. So if your child's already had COVID, I think the vaccine is still totally safe and has been studied with that population. Also gives the best protection. And then the second question was for Dr. Rucoba. What was the second question?
So the second question is,
if you've had COVID already.
Sorry about that. If you had COVID, do the antibodies work better?
And unfortunately, I think we were really hopeful that was the case. And as I said, there is some protection, as certainly in that 90-day window. But the antibodies, the natural antibody levels, and especially studied mostly in adults, do wane over time. And the best way to protect is to do the combination, even if you've already had COVID, both adults and children, it is recommended to get the vaccine.
Thank you. Dr. Siegel, there have been several questions on the chat tonight, all related to your discussion earlier about myocarditis. Specifically, what are the symptoms of myocarditis? How would a parent know? How would a young child know that the child has myocarditis? What should a parent be looking for? How do you answer those questions?
So myocarditis is a very rare complication. Most people look pretty sick. They typically will present with severe chest pain. They'll have what we call palpitations, which is a funny rapid heartbeat. And they also have what we call dyspnea, which is an extreme difficulty, rapid breathing with a lot of shortness of breath along with it. Most children with it look sick. So they're pale and they just have that, I'm really feeling ill sort of look about them, which is very different. It's a very rare phenomenon with the vaccine. And as I mentioned, it does tend to be relatively mild in those circumstances.
Thank you.
I think we
Dr.
need-
Mukherjee, one
Hold
parent
on,
wonders.
wait, Dr. Rucoba, real quick on that.
Sure, go ahead.
I think that what we're missing when we talk about the transient myocarditis, which is relatively mild after the vaccine, is we're missing the fact that COVID infection gives, especially in the males 12 to 17. So the younger men, our younger teenage boys have a rate in the first 12 months of the pandemic, they had a rate of 450 per million cases of myocarditis from COVID-19 infection. This is, we're talking right now, we're talking about essentially probably a 1 to 2 per million chance of getting transient myocarditis from the vaccine, which is not something that I want to minimize. I want us to all be aware of it. And I think we should all be educated, but I also want you to remember that our children have a risk of 450 per million, especially the boys 12 to 17 from COVID-19. So myocarditis is much more severe form when you get it from the infection. So it is not a nothing, and I don't want to minimize, and Dr. Siegel told the thing, but I think we also need to remember that COVID infection causes myocarditis at a much higher rate and a much more severe form.
Absolutely. That's a very good point, Dr. Goynshor. Thank you. Dr. Mukherjee, one parent asked, what would be a reason to not vaccinate children?
So there's really very few reasons not to vaccinate children. Basically, if they've had an allergic reaction to a previous dose, which this is the first time they'd be getting the vaccine, so they really wouldn't know that, but for their second dose, then they wouldn't be the candidate to get the second dose if they had a reaction to the first dose. Or if they had any allergy to any of the vaccine components. The list of those components can be found on the CDC website. And when you look at it, most of the things that are listed are actually things that are in many foods. So it would be really unlikely that a child would be allergic. The only, I think, exception to that would be there is something called polyethylene glycol, which is the main ingredient in a laxative called Miralax. And that is in the vaccine. So if your child is allergic to that, then that would be a reason for them not to get it.
I think I'm looking on the chat, people are asking about heart murmurs or minor heart conditions. I had a family today ask about sickle cell trait. All of those are not contraindications to the vaccine, and you do not have an increased risk of myocarditis with a heart condition or a murmur or sickle cell trait. I'm trying to go through other things. Yeah. Those are great questions. But
yeah, and actually you're at greater risk from COVID having severe problems if you do have underlying heart disease. Plain heart murmurs, though, don't mean you have a normal, just an innocent murmur just means you have a normal heart with extra sounds. But if you do have heart disease, it actually is greater risk. And so you should be vaccinated with heart problems rather than not.
Yeah, absolutely. Thank you for that. Dr. Goynshor, here's a nuts and bolts question. There was one in the chat that came up earlier about flu. One mom wrote in, I understand that adults can get the COVID vaccine and a flu shot. Is there any concerns for children getting both? And specifically on tonight's chat, one parent said, my child got a flu shot recently. How soon do they have to wait to get the COVID vaccine?
Great question. And I think that most of us remember that our kids, when they are 2 months, 4 months, 6 months, 2 years old, 4 years old, they are getting vaccines together. But the COVID vaccine is an inactivated vaccine. That means you are not getting any live virus infection, which means that the vaccines can be given together with other vaccines. Also, there is no time frame that has to be spaced between the flu shot or any other shots and the COVID vaccine. There are some things that might need spacing. Specifically, if your children get some incredibly rare, but a medical condition, like who's getting a medicine called intravenous immunoglobulin or IVIG, That might be a then we would talk about a different conversation. Or high dose steroids might be a reason that we would wait for a moment. But otherwise, and the reason for that is because those would be, it would make the vaccine less effective, but not because it would be dangerous to our children. So flu shots can be given at the same time, or given a day or two, a week or more apart.
Thank you. Next question for Dr. Siegel is one that came in through the chat tonight, and it's this. My child has a cold right now, no fever, tested negative for everything else. Should he get the vaccine as scheduled in 2 days, or should I wait to get the vaccine?
So the only contraindication as far as an illness is concerned would be if you have active COVID, we do suggest waiting. You don't want to be, the problem is that you're going into a group setting and we don't want to expose everybody else in the waiting room to whatever illness it is that you have. Assuming that your illness is not contagious, then no, that's not a contraindication. Most simple colds are contagious from a day or two before you come down with symptoms until a few days after. Schools have been requesting that children be totally asymptomatic before returning to school. In this sort of social setting, it's also an issue for that. Assuming that you have an illness that's been ongoing for 3-4 days, the likelihood of still being contagious isn't huge, assuming you tested negative for RSV and flu and COVID. We are unfortunately seeing all of those illnesses in the community at the moment, including COVID. So to say that we're not seeing it, that's not true. At least I'm seeing it in my office.
All right, thank you. Dr. Mukherjee, one parent asked, would you recommend this for children and families that aren't necessarily high risk and where the adults are vaccinated? How do you respond?
Yes, I would recommend it for them as well. Anyone who's 5 and older, I know earlier in the questions, Dr. Goynshor already mentioned some of the statistics. So I won't repeat them, but basically, by getting vaccinated, they're not just protecting themselves and everybody in their immediate household, but they're also protecting extended family, people who, for multiple reasons, may be unable to get vaccinated. Or there is also a subset of people who may be vaccinated, but because maybe due to medications that they're on, or maybe their underlying medical illnesses or medical conditions, that they're not actually able to mount a sufficient enough immune response to the vaccine. And so they may not be as well protected from the vaccine as the next person. So by having the children vaccinated, they're also protecting those people as well.
Somebody asked in the chat about, sorry, hold on. Somebody asked on the chat, I'm trying to read it, I'm not going to read the actual question, but they were asking that the vaccine, you can still spread you can still get sick after having the vaccine. What would you say to that?
Like in terms of like a.
So they're saying, so somebody was asking, and I couldn't find the question, sorry, was saying that, well, you can still have spread the disease after having the vaccine, which is true at least 6 months after the vaccine for a lot of us. But I was going to say that I think that when the studies looked at it, the kids had a 90% chance, 90% lower risk of even getting illness in the first place. So I think for our kids, even this low dose vaccine gives a good amount of protection from being as contagious as previous. Do you think?
Yeah, I would agree. And I feel like the data out on the adults and the older children also say it really depends on how symptomatic you are. If you have an infection despite being vaccinated, that the more symptomatic you are, potentially the more contagious you are. But the vast majority of people who become test positive for COVID-19 after getting vaccinated are very, very mildly symptomatic or asymptomatic.
Thank you. Right now, Pfizer is the only COVID vaccine approved for this age group 5 to 11. We've had at least a couple of questions on the chat tonight basically summarized in this sentence. Are there benefits to waiting for the Moderna vaccine that's approved for 5 to 11-year-olds, as research has indicated it's been more effective and lasted longer in adults than the other vaccines? Dr. Goynshor, what do you tell that parent?
I think you might be waiting a while, is
Right.
the short answer. So I think that we need to remember that our system is still working, and we have a system that's trying to check and balance. The research, the Moderna vaccine, you're not wrong, has shown a higher levels of antibodies in the short term for adults than the Pfizer. However, that's also the same reason why it hasn't been approved under the age of 18. There has been research there's studies that have looked at the 12 to 17-year-olds as well as the 5 to 11-year-olds are still sitting with and getting further in analysis, because those higher levels of antibodies can cause a higher reaction. So currently the Moderna vaccine in those ages, and they're still working out the kinks, but so far the research is showing that has a higher side effect profile, including higher levels of this transient myocarditis. We are all trying to do the best we can with giving the least amount of medicine and the least amount of vaccine that mounts a protective response. And that's why Pfizer is the only vaccine approved for 12 to 16-year-olds or 12 to 17-year-olds. And it is also the reason why the Moderna vaccine, it may get approved at some point. It may go back for additional research to look at a lowering the dosage or other things like that. But I think that we want our kids protected now and not in the potentially distant future. And maybe it's sooner. I have no idea. I don't think any of us predicted this pandemic, so we aren't totally my foreshadowing. It may not be the best, but I think that waiting for Moderna and then deciding that we find Moderna to be safe. So effective, yes, but safe is the next question. And those both are really important, at least to me and probably to all of you.
Thanks. On a similar note, Dr. Siegel, one parent asked, is there any reason to wait for a non-mRNA vaccine? And somebody in the chat tonight wanted to know if the mRNA vaccines are going to be the way that all vaccines in the future are composed. What do you say?
So the only non-mRNA vaccine that's available currently is the Johnson & Johnson or Janssen COVID vaccine. That one has been given to a much smaller group of people and has had a significant problem with bleeding and clotting disorders. And so it's not been approved in children under 18 as of yet, just as the same argument that Dr. Goynshor used earlier for the Moderna vaccine, that they're worried about side effects from it. That vaccine also has not been shown to be as effective as the messenger RNA vaccines. In answer to the question, do I believe all vaccines will be messenger RNA in the future? The answer is I don't have a crystal ball, just as Dr. Goynshor doesn't have a crystal ball to say that. There are actually a whole host of different types of vaccinations that are used using other technologies as well. The advantage of a messenger RNA technology, though, is they have it and they can change how it's being used, and so they can manufacture it more rapidly than they have other vaccines. Do I expect that more vaccines that are released in the future will be using that? I think so. However, there are certainly other successful vaccines, and I expect those to continue to be used.
mRNA vaccines are extraordinarily expensive. The technology is, way beyond the cost for a lot of vaccines. It took a global pandemic. I mean, the research had been there for 20 plus years. And originally kind of built up with the concern over SARS, which is also a coronavirus, FYI. But it is so expensive. So, if we think some of our vaccines right now are really expensive, this, if it wasn't being rolled out on a global scale and the government wasn't paying for it, would be truly cost prohibitive. So, I think the technology is going to come down, and I do think that this is something. Somebody in the chat mentioned something about the vaccines in France and Germany. And they are using AstraZeneca, which is not approved in the US. And so when we read about international, we have to be conscious over what vaccine, because the AstraZeneca is much more like the J&J vaccine. It's an adenoviral vector. So we want to make sure that when we're thinking about things, we're talking specifics.
And that also hasn't been shown to be as effective. It's in the 70% effectiveness, and also has the same clotting problem as the J&J vaccine. So they're actually very similar as far as both the technology, but also their side effects.
Thank you for clarifying that. All right, Dr. Mukherjee, we have two related questions. Do children need 2 doses in the 5 to 11 age range? And will my child then need a booster in 6 months?
So yes, the child needs 2 doses. And I think I answered that previously as far as the dosing should be, the second dose should be, ideally 3 to 6 weeks after the first one. As far as the booster, there is no information out about that yet. I know today Pfizer's asked the FDA to recommend the booster for all adults 18 and over. So I think if we extrapolate from that, then perhaps 12 to 18 will be next. And then maybe after that, it will go on to this age group. But I don't really have any concrete information on that.
All right, thank you. Dr. Goynshor, here's a perplexing question. Quote, one parent in our household wants to vaccinate our kids right away. The other wants to wait to see if any significant side effects arise once the 5 to 11 population has had a month or 2 of vaccines. Can you speak to parental hesitancy and why getting vaccinated as soon as possible is preferred?
So first of all, I don't want to get in between any marriages. I don't want to be in the middle of any divorces. I want everybody, and I think I can speak for all of us when we want parents to be comfortable with making this decision together. I know for me that I would feel horrible if my child got COVID while I'm hesitating. And I can't tell you that I think all of us can name a whole bunch of patients who were on the fence and they were thinking about it. And then, I mean, I can tell you that's not the point, right? But so from a personal perspective, my guilt would be strong if my child got COVID while I'm waffling, trying to just make this decision. And then honestly, from a selfish perspective, winter break is right around the corner. And I think that I'm going to speak for myself that we would like to travel. And I have, only one child who's still unvaccinated. And I would like her protected as soon as possible so that we can go on and have as normal of a winter, in a holiday season as possible.
Thank you. Dr. Siegel, one parent asked, did the trials consist of any children who had a history of anaphylaxis? Is there any information provided? I'd like to know about this since my daughter has a peanut allergy with anaphylaxis. And I noticed that there's a few questions in the chat regarding children who have allergies of various kinds. I know that's a very common concern among parents in all of our practices. What do you tell those parents?
So as I believe it was Dr. Mukherjee said, contraindication would be specific allergy to components of the vaccine. The one thing, as she mentioned, that's most common is propylene glycol. So there's no peanut in the vaccine. To my knowledge, I don't believe there's any gluten in the vaccine, but someone else can double check that. As far as a risk, that's not an anaphylactic reaction, but that's something that should be listed. The other thing that happens is that all children, so any child who has had a history of a severe allergic reaction, we ask to wait longer. So if you're going to have an anaphylactic reaction to a vaccine, usually it happens in the first 20-ish minutes. All children are asked to wait for 15 minutes after their vaccine, and those who have had a severe allergy, we ask to wait 30 minutes. all of our practices are prepared for anaphylactic reactions, even though they're extremely rare. All of us have EpiPen and all other medicines that are used to treat anaphylaxis in our office at the time of the vaccine. That we're prepared for helping to do that. And in our practices, we all have doctor present in order to take care of that, should that be necessary, unlike some of the other locations. So we're prepared for it. What's the likelihood? Extremely rare. We gave thousands of doses of the adult vaccine or the 12 and over vaccine to patients in PediaTrust, and I believe we had one anaphylactic reaction in all of those thousands of cases. And that's why we watch them more carefully if you do have that story of being allergic to things.
Thank you.
I think that some allergists have suggested that our patients who have allergies take their antihistamine the night before they get their vaccine, take another dose the day of, just to be on the overly cautious. So if they have Zyrtec or at home, or they take it periodically, the allergists have suggested there's no problem in taking a Zyrtec the night before and taking it again the day you've had your vaccine, or even a couple of days after. I mean, so it's something that if your child has an anaphylactic reaction to other things, you can also reach out to your allergist and ask them if they have a particular protocol that they want for your child. I think that that's a reasonable thing to do.
Thank you. Dr. Mukherjee, we've been talking about vaccinating the 5 to 11-year-olds. One parent wants to know, how careful do we need to be with babies that are too young to be vaccinated?
Well, I think they should just continue to be as careful as we've been since the pandemic started, March of 2020. There's so many guidelines given, safety protocols given. I think there's some basic things. I think anyone, this whole last 45 minutes we've been talking about the age 5 to 11. So for sure, anybody in that age group should get vaccinated as soon as possible. I think families who have children who are, age 2 to under 5 who aren't able to be vaccinated but are able to wear masks, they should continue to wear masks indoors when in public, regardless of, regardless of the vaccination status of the adults around them, they should continue to be masked. Parents should choose outdoor activities whenever possible. If they're inside, they should try to choose a location that's as well ventilated as possible. There's, the staying 6 feet apart guideline, that's still there. So they should try to avoid activities where it's going to be hard for their younger children to be able to be 6 feet apart from others. And then the other thing, and maybe a little more pertinent because we are coming into holiday season, is just to really be mindful of who your child is going to be exposed to. If there are people where they are unvaccinated or you're not sure about their vaccination status, and a situation where they really need to see those people, then just make sure you're able to keep that 6 feet distance.
Thank you. Dr. Goynshor, this next question is for you. What effect does the vaccine have on children going through puberty? We've had several questions about the vaccine's effect on development, especially during puberty. What can you tell us about that?
I mean, I wish it could make them nicer and kinder and gentler and less mean to their mothers, but it doesn't work like that. But no, it absolutely has nothing to do with puberty. This has nothing to do with fertility. This has nothing to do with, it won't affect development in any negative way. And there's been lots of groups that have come out and just talked about that. However, there is something that girls should know, that, and women, this has really been reported in women much more than adolescent girls, but it's still something, is that if there may be some dysregulation of your period, about the month, within a couple weeks of getting each dose of the vaccine. It doesn't happen to everybody, but some people will have an irregular cycle that 1 month. This has not actually related to the vaccine. It's actually related to your own body's immune response. So that's actually a really good thing. When we are sick, when we have mounting an immune response to something, both good and bad, it is a natural response to kind of say, wait a second here, if you're under stress or if you're doing something, you shouldn't ovulate or you shouldn't get pregnant. Not that that's something we should even be thinking about with our little kids, but that's kind of why you may see some menstrual irregularities, not weeks, months, not months or years later. We are talking within the first couple days. So when your arm is sore and you're feeling kind of yucky, that can disrupt your menses for your period for a time. But that's all it has to do with puberty.
Thank you. Dr. Siegel, we've had several questions on the live chat tonight about asthma, and specifically one father asks, he's concerned about the potential short-term or long-term side effects from the vaccine for kids with asthma. Specifically, can the vaccine adversely affect kids with asthma more so than kids who don't have asthma?
So the short answer is there's no data to suggest that. The longer answer is that children with asthma are at greater risk of a severe reaction to COVID itself. And so those children with asthma should get vaccinated. Just like anybody else, sometimes asthma may be associated with allergies. If they do have severe allergies, we would make them wait longer, but that's not unless they're allergic specifically to propylene glycol or some other product within the vaccine. We would not recommend waiting per se. Children with asthma, though, are much more likely than to get hospitalized and have more severe illness if they do get the disease itself.
Thank you. Dr. Mukherjee, one hesitant parent asks, if the infection rate is low in my community, should I wait a few months before vaccinating my younger kids?
I don't think so. I think it's best to get them vaccinated as soon as possible. I think that the best way to actually continue to lower the infection rate is to have people vaccinated, because then there will actually be fewer susceptible hosts for the virus to infect. And there's the expectation is that there may be additional variants. So the fewer susceptible people there are to be infected, the less chance of success the variants are going to have. So we know from data over the clinical trials, data in adults, now data is coming out from the 12 and up group, that the vaccines are extremely effective. I mean, if you look at, I think a question that maybe hasn't come up yet and maybe should be answered is, what is the purpose of the vaccine? Because is the purpose of the vaccine truly to prevent the infection at all? Or is the purpose of the vaccine to prevent serious illness from the infection? And I would argue the latter, and we know that the vaccines are extremely effective at preventing serious illness, hospitalizations, and most importantly, death from COVID-19 infection. So I think even if the infection rate in the community is low, that is not an indication to sort of drop our guard and say, we're not going to be vigilant about vaccination.
Somebody asked, just to follow up on that, they asked, how deadly is it under 5? Wanted to know what the danger, because we were talking about you were talking earlier about the younger ones. And I just want everybody to look, I looked it up, and as of November 3rd, which is because they report weekly, there have been 206 deaths in children ages 0 to 4 from COVID in the US, and ages 5 to 18, there have been 474 deaths, making this much more dangerous, that
it's in the top 10 of all causes of death.
Yeah. Speaking of those younger kids, Dr. Siegel, we've had several questions come up in the chat about that next step. We've just started immunizing the 5 to 11-year-olds, but people are already asking about the vaccine for those younger than 5. What can you tell us about the prospects for that group?
So studies are ongoing. Exactly how many patients and so on, and whether or not the FDA will approve it, my crystal ball is not working quite great. What I'm reading in the newspapers is anytime by the end of this year, or my bet would be sometime following. I believe that the FDA has done an extremely cautious job in deciding on when to release these vaccines. Even though it's been rapid relative to other things, the pandemic has been so severe that we've been able to get the number of cases of illness to meet all of those criteria to find out how well these things work. And so I believe that eventually we should have a vaccine for younger children. If I were a betting person, which I'm not, I would bet sometime later next year, probably to the middle of the end of next year. But I've been wrong so far on a couple of other guesses. That's why I never bet.
Thank you. Dr. Mukherjee, one parent asked, should I plan for my daughter to be absent from school the day after her shot?
No, I don't think so. I mean, the vast majority of kids really have no side effects. If they have anything, it's the most likely thing would be like a sore arm. Maybe they might feel slightly under the weather, but I don't think enough that it would warrant her missing school. I've had parents ask me, should they preventatively give their kids, Tylenol or Motrin or Advil, something like that. And we never recommend that with any vaccine, that you preventatively give any pain reliever. But I think if the day after the vaccine, there is a sore arm or a little bit of general malaise, I think that would be okay to give the acetaminophen or ibuprofen at that time. But again, I don't think it would be severe enough that would keep her from going to school.
Thank you. Dr. Goynshor, we got several questions about the trials that were done on the 5 to 11-year-old and small, quote, small sample size that was studied. Another parent wrote in tonight, what is your level of concern about the general short-term testing monitoring of the COVID-19 vaccines versus most vaccines that go through longer, more in-depth trials? What do you have to say to that?
Well, I mean, I think that all of us have a level of apprehension that's appropriate. I mean, I think that, we would love to have years of data, but we also would like to, I think that we know and understand that the research that came behind this vaccine, the type of vaccine, is 20 years in the making. So this is not a radical, brand new, never tested such. I would love more data. I would love more time, but I am holding my breath, every day that my children don't come down with COVID. And so we have to balance the concerns. I am more concerned over the risk of myocarditis from the infection than I am from the vaccine. I also think that we have a lot of data around the world in older and adults who have had much higher doses. And so we are much more comfortable with this vaccine after tens of millions of doses have been given. And I'm probably way underestimating that number. Any higher, hundreds of millions, billions? I don't even know the numbers. These are nonsense numbers to me. So I guess, in an ideal world, we would have years, but I also don't think that I don't even want to wait days or weeks anymore for my own children, because I want them protected and I want to, so that's my opinion.
Thank you.
I agree.
Soma, yeah.
Me too.
Oh, good.
Dr. Siegel, this question came in earlier too, and it was about serum sickness. One mother said her child had serum sickness associated with an antibiotic, which is uncommon, but we do see it periodically, and wants to know what is the chance that her child could get serum sickness because of a vaccine like COVID.
So first of all, there's no antibiotics in the vaccine. So serum sickness is usually a reaction to a specific agent. And so I don't put it in any greater risk than any other severe allergic reaction. So yes, we would observe that patient for a longer period of time, but it's not a contraindication unless they had a severe reaction to something in the vaccine. Since there are no antibiotics in the vaccine, there is no risk from that particular agent that this child was exposed to.
Thank you. And now I have a question that I'm going to put to each of you, so you can each answer. We'll start with Dr. Mukherjee, since she's up in the upper left-hand corner, at least on my screen. This has been asked several times in the questions that were sent to us over the week, and that is very personal. Would you get this shot for your child, 5 to 11 years old, and would it matter to you if you had a boy or a girl? Dr. Mukherjee, what do you say?
So I think I'll answer the last question first, which it wouldn't matter if I had a boy or a girl. I actually have one child who's a boy. And he was 12 when the 12-year-old indication came out, and he got his vaccine the day after it was available. And he did fine, got the second dose, did fine. But had he been 11 or in the 5 to 11 age group, I would have no hesitation to have him vaccinated.
Thank you. Dr. Goynshor, I believe you do have kids in this age group.
I do. So I had a 12, now 13-year-old who's had the vaccine, and I have a 9-year-old. And I will tell you that she's had her first dose. She was totally fine. But that's my own child. And we are more than relieved to know that we're going to have full protection before the holidays.
Thank you. Dr. Siegel, you and I are a little bit older here. I certainly don't have any kids in that age range. All of my daughters are young adults and all got the vaccine and their second shot. But I would have no hesitation either if I had a 5 to 11-year-old getting it. I think the evidence is pretty solid, as evidenced by the CDC's panel that recommended the vaccine in this age group unanimously. And I wouldn't have any problem giving it to a 5 to 11-year-old child of mine. What about you?
So I have children. They're all young adults as yours. They've all been vaccinated as of yet. They've been vaccinated using different vaccines. Some have gotten the J&J because he's in college, and that's what they offered him at the time, and he's since gotten a booster. I've gotten the other 3 have all had either Moderna or Pfizer vaccine. I do have 2 grandchildren in that age range. My 8-year-old grandson and my 5-year-old granddaughter happily showed off their Band-Aids to me on Thursday from where they got their shots. And if you really want me to bore everybody, I can show you pictures of that. But I don't think everybody else needs to see that at the moment. My point is, yes, there's no question I would offer them the vaccine. Their parents were thrilled that they were able to get it. Selfishly, they're supposed to travel, and they will be able to do that given the second dose of vaccine. Full protection happens 2 weeks after your second dose of vaccine. So you're not considered fully protected until that point in time.
All right.
I think that one of the things that we always I tell my patients, and I think you guys probably do it, is we will never recommend something that we don't recommend we will not do
Absolutely.
for our children. And that is, I think that's something that I can promise for all of us.
For sure, 100%.
Absolutely. I agree. All right. It is now 7 o'clock. I want to respect everybody's time. I appreciate all the questions, and I'm sorry that we couldn't get to even most of them. There's just been a flood of questions that are coming in, and we certainly couldn't handle them all in an hour. So I do want to remind everybody a few things. First of all, the recording of this session will be going out in an email sent in the next few days. And also that we are already vaccinating we're vaccinating at all of our offices during well-child visits during the day. And we have several mass vaccination clinic sites at many of our offices as well. You can find all that information on our website, www.pediatrust.com/COVID. And Also, to remind everybody that if you have questions that were unanswered tonight, please ask your PediaTrust pediatrician or your pediatrician if you don't belong to our PediaTrust offices. Have that discussion. It's important that you get your questions answered. It's important that you feel comfortable with this vaccine. We feel very strongly about it, but we want everybody to feel comfortable with the decision to get the vaccine. So please get your questions answered by your healthcare provider. All right, thank you all to our panelists, Dr. Mukherjee, Dr. Goynshor, Dr. Siegel. Thanks to our help behind the scenes. And thanks to all of you for attending and for your questions. Good night.
Thank you for moderating, Ruben.
You're welcome. And I hope everybody has a healthy winter.